the Alliance on Aging is a healthcare hero because they've been serving the elderly in this community for many years, directly or through their cadre of providers. They provide for programs to the elderly so they can stay at home. They provide information to their caregivers, and they have innovative programs to prevent hospitalization. For the elderly that want to stay in their home, they provide bathing, they provide assistance with daily living. The Alliance also has a pilot program, one of the 3 in the state of Florida, to reduce rehospitalizations. They do education regarding insurance. It's a program that helps you navigate through Medicare, Medicaid, and any health insurance you might need. They provide information for older adults, for people with disabilities, and for caregivers. The Aging and Disabilities Resource Center last year answered 48,000 calls from people in the community seeking assistance. By the measures the governor has done, this is the top performing agency in the state of Florida. They've saved around 50,000 months of institutional care. The economic impact of that for the taxpayers and for the community is $200 million. It helps everybody in the community.
You know, at Chapman Partnership, I cannot imagine offering the services we do without Miami Hope Clinic. Alva Chapman, our founding chair, who started this organization, wanted to provide permanent solutions for those who live on the street, but unless you allow them to deal with the immediate health issues, then and only then are we able to focus on how to obtain independence and self-sufficiency. So we've been doing this for almost 20 years now, with a 63% success rate of outplacement, and Miami Hope Clinic is one of the priority reasons. Every person is triaged in the clinic within 48 hours of arrival. So part of our efforts is to have emergency room diversions. That last year alone was about $1 million in savings to our community. We have 800 beds that are running about 103% occupancy level. 43% single men, 13% single women, but an amazing 44% families with children. So more than 200 children are with us every single night of the year. More than 70,000 people have been able to access services in the Miami Hope Clinic. We're grateful to have them as part of our team every day.
Miami Children's Hospital has 3 intensive care units that provide care to the sickest children in our region and beyond. So the 3 ICUs are first our neonatal ICU, a pediatric intensive care unit, which serves children from trauma to near drowning to post-op very critically ill patients. And then the 3rd ICU is our very specialized cardiac intensive care unit. Their outcomes have been recognized nationally by the Center for Medicaid and Medicare for outstanding patient care outcomes and results. We were one of 2 organizations in the state of Florida, 2 hospitals that actually were designated and recognized by CMS. We strive every day to outperform not only national benchmarks, but outperform ourselves. And an example of that is in our bloodstream infection rates. We have outperformed those by reducing beyond 3/4 of what the national rate is. In all of our ICUs, 90,000 children come through our emergency department. We're the 3rd largest emergency department in the nation that serves solely pediatrics. Miami Children's intensive care units really are a jewel.